Okay, I just want to let everyone know that this meeting is now being recorded. Um, Everyone, please mute your phones except for Board of Health members right now during roll call, please. Thank you. Okay, Mr. Zelko?
Here.
Shit. I'm not even able to even read it. I just like forwarded it to stuff. Mute your phone. Mute. Okay.
Sorry. Mr. Zelko?
Here.
Dr. Terrell? Dr. Terrell?
Yes, here.
Okay. Mr. Cicero?
Yes, here.
Mr. Gould?
Present by cell phone.
Mr. Hertzman?
Here.
Dr. Lipinski? Dr. Pitzelos? Ms. Mackey?
Here.
Dr. Ramos?
Here.
Hi. Ms. Ryland?
Here.
Dr. Soderquist?
Here.
Ms. Tyson? Ms. Tyson? Okay. We have a quorum. Marie Lindsay, are you on the call? Dan?
Yes.
McGrath?
Sorry. I was on mute.
Oh, hi, Marie. Sorry.
Hi.
Okay, Dan McGrath, you're on the call. I can see you're on.
I am, yes.
Okay. All right. And then we have Sue is on the call. Elizabeth is on the call. Dr. Troyani, are you on the call?
Yes, I am.
I'm sorry, I didn't get a chance to mark everyone because I got distracted.
Dr. Triani's on the call.
Okay, Mary Marigolds? Dr. Bird? Tom Casey?
Yes, I'm on.
Georgia Vanderbilt?
Yes.
Katie Weber?
Here.
Steve Randy?
Right here.
Okay, thank you. I guess, and I can just go ahead and look and see who all else is on the call. Okay, Mr. Zelko, do you want to go ahead and lead with the Pledge of Allegiance?
Yeah, I'm going to ask John Cicero to lead us in the pledge. Just one person will lead us. John, will you do that, please?
I pledge allegiance to the United States of America, and to the republic for which it stands, one nation, indivisible, under God, with liberty and justice for all.
Thank you, John. Okay, under my comments, I just want to welcome everyone to the meeting and thank you for your participation today. That's it. Go ahead, Sue.
I just wanted to announce to everyone some very sad news. We were notified yesterday that one of our employees, David Partito, one of our behavioral health clinicians, passed away over the weekend. So if it could keep him, his family, and him in your prayers, we would appreciate it. He was with our department for, I believe, close to 25 years.
Very
That's
sad.
all I got.
Very sad, yes.
Okay, under public comment for agenda items only, Don Gould, I understand that from an email that I got from Mimi Cowan, that you'd like to address the board concerning availability and responding to public comments. Did you want to do that now, Don? I understand you have to leave early.
I'll be brief, Jim. Apparently that the county board is receiving, the county board office inquiries regarding the public wanting how to contact the members of the Board of Health, and our website currently just has small bios and doesn't have any contact info like email or phone or anything like that. So I think it just, for myself, it would be positive if we could put that information out there on the health department website for the general public.
Don, are you referencing our personal emails and personal phone numbers? Is that what you think would be appropriate?
Well, I think that, certainly the department can go ahead and give us all an email address. That would be fine, just so that there's some means of communication with the public.
So this would be through the willcountyhealth.org, a email address
Right.
for each board member, and then we would need to go in and check that however often we did, and then respond to the individuals. Is that what you're envisioning?
I think that's what they're asking for. Yes, they're looking for that option.
Any board members have any comments on that?
Hi, Jim. It's John. My preference would be to have a department email for board. In other words, it's like a repository for any concerns for board members. And then based on what is received in that mailbox, it could be determined perhaps through administration whether staff can field a lot of the inquiries. I'm not comfortable with, having a mailbox that has to be checked on a regular basis and responding directly to the public without, certainly then you have to have feedback with staff to be able to answer questions. I'm not sure what level of involvement the rest of the board members are comfortable with.
I would agree with John myself, not having a personal email.
And this is Marie Lindsay, if I could just comment. For example, Illinois Department of Professional Regulation, there is no information on board members. So I would certainly support a middle ground here. In fact, in that case, they're actually kind of discouraged. They don't really want the public interacting with the board because they don't want an individual board member saying something that might not be the right thing to say.
Well, that's a good
Right,
point.
and our own personal comments would not be reflective of the board, and we were just one member, so we couldn't take action. I'm not sure of the value, but I do see the value in having a centralized location where folks could submit concerns if that's the intent.
Okay.
That would make more sense.
And I think we could
Plus we have the availability of attending a board meeting and on two different agenda items where the board comments can be made by the public. So, Don, how about if we ask Anthony to take a look at some options? Maybe we'll take a look at what other counties are doing to better communicate with the public through the Board of Health. And we can bring that back to our meeting in March. Is that acceptable?
Yeah, if that's the direction I think you're going to go with. I mean, I've had mine out there for years. I check it every day or every other day, and it works for me. But, I'm in contact with the public probably more than you guys are, but it's not an insurmountable thing. But I think it's something that's easy to be done.
Well, let's ask Sue to work with Anthony and come up with some options for the public being able to communicate with the board through the website and how that would work and the logistics of doing that. And then we'll bring that back to the next meeting and see what we've got to look at. We'll put it as an agenda item, Stephanie.
Okay.
Thank you, Jim.
Margaret Tyson has her hand up.
Yes, I'm sorry I got on late, but I'm based on, this is, I think this is a good idea, because if we have I'm thinking if we had a repository where if information is fed in, but we have to make sure that someone's checking it, and then if necessary, if it's something related to a specific board member, they can take care of it. But if not, somebody with more knowledge needs to take care of it. So that way things don't slip through the cracks. And I think this is a good way this is a good avenue. This is a good method that we're going to go through with this repository. And I'm pretty sure probably a lot of other boards are probably using this as well.
Okay. Any other members have comments? Otherwise, we'll expect it to be on the agenda for next month, and Anthony and Sue can work on it.
This is Tina. I have maybe a question. Could we all, as a person that's still fairly new to the process, and I've had this question come up lately with all of the COVID information and the questions from the public, could we also then have maybe some protocol for how the board and the staff would hope that we would respond? You know, I have people in the community ask me questions, and I try to be very careful about my response and refer people to the website or refer people to staff. And I'm not super clear about what my response should be. I don't ever want to say anything that would embarrass someone or put us, give information I shouldn't, and so I'm still a little nervous about how that unfolds. So maybe in addition to the opportunity for the public to ask questions, some direction for us or protocol on how you would prefer that we would respond to.
Well, I think that's very important because we're a policy board, and there was never an expectation the board members would be familiar with every program that's operated. And certainly the last thing we want is to be shooting from the hip and providing information that is not standard or practical and misleading the public. That's the worst thing that could happen. So
exactly. And is there one person that we should refer people to, or I'm often thinking, well, I don't want to impose. I don't want to say, oh no, call Dr. Triani for that question, but then no, call Mr. Brandy for that question, or is there one person that you prefer that we refer questions to, or would you rather that we called and asked the question and then provided the answer?
No,
so, I mean, sort of generally, you're getting the drift of what if some thought could be given to giving us some good direction, so we respond.
Wouldn't the answer be that we actually would refer back to the executive director?
Okay,
that's the easiest thing to do. We don't know who's responsible for which
protocol, then
exactly.
If that's the protocol, then just let us know. That's our preference.
Yeah, I think that's a very good suggestion, to have a protocol for the board so that everything is handled in a consistent manner.
Exactly.
I've been on the board a long time, and I can recall one phone call that I got from a member of the public, and he probably got my number. I'm in the phone book, so it's not like I'm hiding. And his suggestion had to do with the fees, late fees and fees for restaurants during this COVID shutdown. And it was a very good suggestion. I called Sue, I gave her the information, and at the next board meeting and at the county board meeting, we made that adjustment in fees to the advantage of restaurant operators. So there is benefit, and it's good for the public. The ideas, if they're just complaints, well, that's one thing, but this was a very solid, well thought out proposal, and it went from him calling me to it being enacted by the Board of Health and the county board. So public feedback is important, and I think we should try to find a way that benefits the public and is an outlet for them, but doesn't burden board members by getting 20 phone calls asking how do they schedule a vaccine administration. I mean, there's a balance there, but there is benefit, and we'll look at it, and we'll come up with something that we can look at in more detail at our next next meeting. So anybody else have any comments on that? Okay, I'll open it up for public comment for agenda items. Anybody wish to make a comment?
This is Stephanie, Mr. Zelko. We just got to keep in mind that, well, we have a quorum now, so I guess we don't have to rush through it for Don Gould. I'm sorry.
Okay. All right. Anybody have anything to add or say?
Oh, this is Margaret again.
Okay.
I was thinking if we're gonna, what if we do something like a repository, maybe with the phone filling information, you could treat it like tech support. When you call tech support, you have someone you need to funnel it to, so not all the phone calls go to Sue. So that way, if it needs immediate attention, you get it to the right person immediately. It's not sitting on Sue's phone or Sue's phone bank or anything like that.
Yeah.
The
Yeah, it's a
other
good
thing,
suggestion.
Jim, the other thing is, remember, we just developed this at the task force, the meetings that we're supposed to be having once a month. Maybe having those names available would probably speed up the process a little bit better, because we might know as a group that committee would have some answers, but I still would prefer not to answer the question, but refer them back to the executive director.
Right. Well, I think a protocol with how this thing will function and what it'll look like is what we need to have.
I agree.
To look at. I mean, we can all have our opinion, but let's see what they can put together, maybe based on what other counties do. And, we'll go from there. We'll look at it next month. So any other public comments on agenda items?
It looks like Ben Dietz has his hand up.
Hello. Can you hear me?
Yes.
Yes, go ahead.
Perfect. My name is Ben Dietz, and I'm an alderman representing the city of Wilmington, which is in southwest Will County.
Sure.
Just wanted to kind of bring some issues to light that I'm experiencing in our local community. I don't know if you're aware, but on a map, we're about 20 miles away from the nearest vaccination site, which also happens to be the health department building. And we're also an older, aging community. We also have a partner city right next to us, Braidwood. So between the two cities, we're about 12,000 residents that have very low access to any kind of vaccine rollout through either Jewel or the health department or what have you. So I'd like to know what the plans are to extend the community vaccine partner program to one of our local pharmacies or potentially a vaccination site within our community, such as our city hall. On the other hand, I would also like to thank you guys for holding a vaccination program for our local school district, which has been in full in-person learning for the entirety of the school year since the beginning. And they will finally be getting their first shots next Friday. So I'd like to thank you for finally getting our in-person educators vaccinated.
Congratulations on having your schools in session. That's a tribute to the school board and elected officials that they value the education of our children. And have you had any incidents of COVID in the schools since they've been open?
We have, and the school board and the superintendent have kept the community very well abreast of each individual case, as well as the contact tracing that they have been doing. It's been nothing short of moving mountains to make sure our kids stay in school.
That's great. Congratulations. Who'd like to handle the question from Ben?
I will.
Okay, Cindy, go ahead.
All right, so we are in the process of planning mass vaccination clinics for other areas of our counties that are not currently being reached. We are well aware that Joliet is not the best location, especially for our eastern, southern, and most northern regions in Will County. So we are working closely with EMA to build a large mass vaccination plan clinic and looking at locations across the county. So that's one of the avenues that we're taking. We're also looking to address specific communities at large manufacturers and to address the specific needs of that business. So we have plans in place for that. The only thing that's really holding us up from being able to continue to expand. We're doing 5 or 6 clinics in different locations every single day. And in addition to 32 partners that we are currently pushing vaccine out to, we just have a severe shortage of vaccine right now. So we're having to hand pick and pick and choose who we can give vaccine to. So shipments that we're getting right now are second dose shipments. So we're not able to schedule many first dose clinics right now. But as soon as the vaccine allotment continues to pick up, we will begin to roll out the plans for mass vaccination clinics. And we do have particular interest in reaching the communities of Wilmington, Braidwood, Shanahan, Moni, Bolingbrook, Romeoville. We want to make sure that there is better distribution of the vaccine because we do know that your community has some mobility needs as well.
Awesome, thank you. Just kind of a follow-up. So we have a local case in point. So we have a local pharmacy that has started to put the paperwork through to get the vaccine when it becomes available. I would hope that we would plan this in enough advance so when the vaccine becomes available, we're not chasing down paperwork at that point in time. That once it's available, we already have those partners ready to go. And so far, I know our local pharmacist that has reached out to me, they haven't heard anything back other than they filled out their paperwork and that's it. So I
assume that they're in the process of becoming a COVID provider. The process is taking a very long time in the eye care system. So what I would do is actually probably connect that pharmacy directly with our vaccine coordinator here at the health department. She has the ability to look up in the eye care system to see where they are with the enrollment process. And also so we can begin to have discussions with them about a vaccine allotment, where they are in the process. We've also developed an online form where all the pharmacies that are COVID providers can order their vaccine from. And so they kind of go in a queuing process. So these are all conversations that we can begin to have even before the pharmacy has received their COVID vaccination PIN number.
Fantastic. And how can we reach out to that person? Because I can't find any real information on the website to.
Yeah, you can, if you email me, I will connect you to her. My email is cjackson@willcountyhealth.org. That's Cindy Jackson, so cjackson@willcountyhealth.org.
Thank you very much.
You're welcome.
All right, thank you then.
Mike Frissalone has his hand up.
Hi, Mike, go ahead.
Yeah, Jim, hi. I wanted to comment on new business item E, resolution 2114, but I know Sue has an explanation when we get there, so I don't know what my comments are until we hear the explanation.
Okay, we'll spend some time on that to get the board members up to date on what's occurring. So we'll have time for you then, Mike. Don't worry.
All right, thank you.
Okay, and then we have Elizabeth Cervantes has her hand up.
Go ahead, please.
Yes, thank you very much. My name is Elizabeth Cervantes. I'm co-founder of the Southwest Suburban Immigrant Project, and we're based in Bolingbrook. And I wanted to follow up on the conversation that, or the one of the first questions in reference to the mass vaccination sites. Cindy, I heard you say something about 5 to 6 clinics that are happening every day and 32 partners. And this is actually the first time I'm hearing about this work that is happening. And I think it's a community-based organization that has over 3,000 families that are members of our community and our constituency, that we would appreciate understanding what is the communication process for partnering with community-based organizations and the health department to plan mobile vaccination sites. I understand that the mass vaccination kind of centers is a plan underway and it's being figured out. But I'm learning a lot of things just by jumping on this meeting. I think it would be helpful if we knew in advance what is the clear process for which y'all are employing to partner with community-based organizations. Right now, it's on very random and sort of you mentioned something about handpicking and choosing. And so I wanna, if you could clarify that, that would be very helpful.
So with the clinics that we have in place, we have a max vaccination clinic, and that's one of them every day at the health department. We've got Joliet West that's happening every day at Joliet West. And then we have specific community partners that we are going out to businesses that have large numbers of staff, typically in, a lot of them have been in 1A. We're starting to move on to 1B to vaccinate agencies that have large numbers of employees that need to be vaccinated. We also have, when I talk about partners that are pushing out vaccine, I'm talking about all of the partners. So from all of the pharmacies, there's 8 Jewels, there's 5 Myers, there's 2 Marianos, Oak Street Health, several Walgreens, Primary Care, Aunt Martha's, Will County Community Health Center, Kodo Care Pharmacy, Suburban Healthcare, Innovative Venture, Renal Center Joliet, and then St. Jude Pharmacy is a brand new provider that got their COVID provider access this week. Amita Bolingbrook, Silver Cross Hospital, and Silver Oaks Behavioral Health Hospital are some of the partners that we've been working with. So any of the needs that we've had or people have reached out for a clinic, there's some requirements that have to be met in order for us to send a strike team out to them. We have had to limit those. The strike teams that we have scheduled this week, we've had scheduled for months. So I know that I have a meeting with the Spanish Community Center on Friday, as well as the Southwest Immigrant Project, to begin to discuss how we can work together in planning vaccination clinics for your communities.
Got it. I think that's helpful. So what you mean by partners is health providers and such that would qualify within the 1A and businesses and that's that type of partnership.
So we're facilitating some of those strike teams that we like to call them, going out and targeting specific businesses. And some of those are being done by our pharmacies.
Hi, this is Sue. I just wanted to interject something. The partners that Cindy is talking about are partners that have staffing to hold their own clinics. They have individuals that can provide vaccine. We deliver the vaccine, and they have gone through the Illinois Department of Public Health process to become a COVID provider. And so we deliver the vaccine, they take it, and they have attested to certain storage and administration requirements, and then they actually provide the vaccine to others. So that's what that partnership is.
That makes sense. And the health provider aspect would have the trained professionals to to actually give the vaccine. I noticed Lewis University was also another site that held a sort of a vaccination event, and I think we're looking forward to meeting with Cindy. But I think just for the purpose of clarity, the idea then that these current partners are making sure that the vaccination is happening for people in 1A, and what should we say to community members who are now in 1B, the phase 1 category, and that are eligible, and what's the plan for that?
I'm sorry, who has the dog? Can you please mute your phone, please? Thank you.
Thank you. So yeah, just the question is, what is the plan, I guess, or what response can we give to our community members in our constituency that would fall within category 1B in terms of where they can register and obtain their vaccine as essential workers. I think it would be really helpful if we're able to help with the communities that already trust community-based organizations in explaining what the definition of an essential worker is and who actually qualifies.
So is your question about who qualifies as essential worker, or your question about where they are or where we are within the 1B phase?
Both. So how would the Health Department specifically, how are you defining the 1B essential worker category and also broader than essential worker? and where are you at with that?
All right. Well, on our website, we have our phase list on there. And so I will access that list to, even when I'm making decisions, I want to make sure I refer to that list. So it's on our main page and it explains the distribution process and everybody that falls into 1B. Our list mirrors the IDPH list and the plans that they've given us. We have to follow their guidelines. As for 1B, it's going to take us a very long time to get through phase 1B. Just looking at seniors in particular, we have about 93,000 seniors, and we've gotten through most of 1A and some of 1B, and we've given out like 72,000 doses of vaccine. So it is going to be time consuming, and it's very difficult to put a timeline on where we are and when people will be contacted. Right now it's based on vaccine availability. So as soon as vaccine becomes available, more appointments become available, more notifications will continue to go out.
Thank you, Cindy. And not to take more time, but just to kind of wrap this up, because I know we're meeting with you. I think right now people should continue then to register. 1 second. Should continue to register right now, and should they expect basically as vaccine is ready or as the partner that you have is able to provide it?
Yes, and that's exactly how we are distributing the vaccine email. So what's happening is basically as there's appointments available and vaccine is available, and we have ways for people to register for appointments, we send out mass notifications using the Everbridge system, which is a reverse 911 system with EMA. Anyone that has filled out our survey will get a phone call, they'll get an email and a text message, or a mixture of, depending on what kind of contact information they gave us, with instructions on how they can schedule their appointment. So yes, we encourage people to continue to fill out the survey because it's a great way for us to send out notifications and all the ways that people can register for an appointment.
Thank you.
You're welcome.
Okay, do we have any other comments, or we'll move along to on our agenda? Anyone else? Okay, we'll move on to approval of minutes. In your packet, you received a copy of the minutes from the January 20th regular session. I'll entertain a motion to approve the minutes in a second.
Move Cicero.
Second,
Second,
Ryan.
Mackey.
Been moved and seconded. Any additional comments or corrections?
I do. Sorry, Mr. Zelko. Sue and I had discussed this. After the last meeting. So during the last meeting, I know that Mr. Delrose had mentioned that the grievance was tabled, and I interjected and to let you guys know that that was not tabled. And then Dan interjected and said he saw it was tabled. And then after the meeting, Dan called me to let me know that I could share this with you guys, that I was correct. So going forward, I think that I just was asked for the board to have confidence, and if I let you guys know, that an action was not taken, because I do the minutes, and at this point I know it, I'm very well versed in it, to just take my opinion into consideration.
Well, you've got the tapes. You know what's on the tapes, and
Right.
That's pretty easy to review.
Yeah.
I won't put my memory against your tapes, that's for sure.
So I knew they hadn't been tabled, so that was just my only, because it made it kind of difficult to include a table of something that wasn't tabled. So that's just my only comment.
Okay, thank you for your comment and your good work on the minutes. Thank you.
Thank you.
All right, it's been moved and seconded to approve the minutes. Call the roll, please.
Okay. Mr. Zelko?
Yes.
Dr. Terrell?
Yes.
Mr. Cicero?
Yes.
Mr. Gould?
Yes.
Mr. Hertzman?
Yes.
Ms. Mackey?
Yes.
Dr. Ramos?
Yes.
Ms. Ryland?
Yes.
Dr. Soderquist?
Yes.
Ms. Tyson?
Yes.
Okay, roll call is complete.
All right, the minutes have been approved. We'll move on to the treasurer's report and department financial reports. Elizabeth?
Good afternoon. So I'd like to just say a couple comments prior to us looking at the sample reports that were provided by the county. So first of all, we are in D365, which is the new financial system, and they do have some canned reports in the system, but none that will exactly meet our needs. So the county is currently going through, their staff is currently going through report builder training so they can learn more about how to develop some reports that could meet our needs. So the county actually pulled these reports together, exported them to Excel, and gave us some samples, which we will go through in a little bit. The biggest difference I think we need to understand is that the previous or the older reports that we would pull from New World was a cash-based report, meaning what we received that month was received that month. Now in D365, it's a modified accrual report, meaning they will accrue things back to previous months. And right now, because we're still receiving for fiscal year 20 and things, they will accrue back to FY20. So that I think is a big difference that we need to always keep in mind, that they are somewhat different, so they're not going to look the same. Also, the reports we submitted, they are not official. In the past, when we would submit the statement of expenditures and the schedule of revenue, we had our own internal way to confirm all the numbers. Currently, we don't have that figured out, and the county is working on that. So when they send us the report, we want to be able to confirm the numbers. So we're still working on that. Another thing is, in the past, we sent all the deposits to the county, just, as in a money bag, the money and everything, and said here, and they would enter them into the system and deposit them. Now, our financial division under the, ownership of Denise, she actually starts the entry of the deposits. We send them to the county. They receive the deposits and then they enter the deposits. So there's a difference. They are receiving them saying, okay, we got them. They made it to the county building. And then at a later date, they are going back and depositing it. Unfortunately, they're a little behind. So they have quite a bit down there that they have accepted, I guess would be a better word, but have not deposited. So that is something that we're still working on, and they're still catching up on that. And at this point, they have approximately $800,000 of grant payments that we have submitted and they have received, but they haven't deposited it yet. The other item is we also have over $2 million in grant checks here that we can't even start the process on putting them into D365, because when we have these grants that are reimbursable grants, we spend the money and then we put in our report, and the agency will send us the money to reimburse us for the things we expended. Well, unfortunately, when they transferred from New World to D365, some of those, or a lot of those expenditures for fees and for the 10% de minimis costs did not get transferred into D365. So there's no way to receipt a check against nothing. So we still are waiting for those items to get somehow put into D365. So then these grant checks can then be receipted against those expenses. So that is a holdup. Another thing that I wanted to explain is revenue is receipted differently. So previously in the old system, we had a grant number and a revenue number for every single grant we had. So no matter how little the grant was, we got a separate revenue number, and we were able to determine what money was coming in for what grant number, or for what grant. In D365, the revenue numbers are based on the funder. So for example, If we have 5 different grants from Illinois Department of Public Health, there is one revenue number. If we have multiple grants from Department of Human Services or Health and Human Services or HUD, whatever, there's one revenue number per funder. So what we did then is we then created project codes because we have multiple grants from these various funders and multiple divisions for multiple amounts of money that have actually probably different start dates and different end dates. So we have created what they are project codes, and we used to use those in New World, but in D365, the project codes will be able to track expenses and revenue. However, we haven't gotten a report yet that we can use to pull the revenue and the expenses by project code. So that is still being worked on at the county level. So unfortunately, at this point, these are sample reports. These are probably not what they're going to look like once they actually get Report Builder connecting to D365. But I just sort of wanted to give you the lay of the land that we're working with. We had obviously worked with the county for probably 2+ years as this was being developed. Maybe it wasn't 2 years, but it seems like it's been a long time. And they have had our sample reports for a while. So, you know, they are working through how to generate reports for us. So is that okay if I go through these reports that they did give us? Because I guess what I'm looking for is, are these that they drafted acceptable to the Board of Health? And will they meet our needs for you to monitor our revenue and expenses monthly?
I would say, yes, we can go through them, but let's not spend 20 minutes on each report.
No.
And I think that as the board members have an opportunity to look at these at home and at their leisure, we may have more input as opposed to seeing them for the first time today and trying to judge what's there. So go ahead and get started.
So could we start please with the change in cash report? 2 months ending January 2021. It's called the change in cash report. So this one is what the county is saying may be the treasurer's report that you're used to seeing. Here's the treasurer's report that you used to see. So if you take, I don't know if you remember from the ending, the month end of November 25th, our ending balance was approximately $9 million. So on the change in cash report, if you take the beginning balance, which is 5 million, add it to our investment balance, which is 4.2, you come up with approximately $9.2 million. The reason it is not 9 million is because there were 5 days where they closed us out of D365 and New World. So from November 25th to December 1, deposits were still being made. So that is the difference between our ending balance from our old treasurer's report to this new treasurer's report, which it was at 9.2. Now the ending balance on this new treasurer's report is approximately $7 million. So that is the first report. The second one I'd like you to look at is the balance sheet. So that says balance sheet 2 months ending January 2021. So this gives us basically a summary of the 2 months of revenue and expenses, investments, advancements on grant payments, and a variety of different categories. And so this is just basically a balance sheet. And once again, if it does show the beginning balance, it shows our investments. And then you do have to do a little math with taking out the unearned revenue and the change in assets to get to that 7 million that was the ending balance on the previous sheet. But it isn't, you know, just a balance sheet. So that's something you could look at. The next report I'd like you to look at is our revenue report, 2 months revenue report ending January 2021. Now this one does group things together. So we have deposits you have all your information from the adopted budget to the revised budget, and then it shows the revenue that was brought in. So It does correlate back to the very first report. It shows that we brought in permits and licenses of over $1 million. It shows that we did get a grant payment for WIC, which is the $150,000. And then it does show the miscellaneous revenue, the rent revenue, the revenue from CHC's managed care capitation. And that does show then that our total revenue for just FY21 ending January was 1.5 million approximately. So that's the revenue report. Now, I do want you though to look at, there's a statement of revenue and expenditures. If you could look at that one, the very top of that report correlates to the revenue report. The next report I would like to go over is the budget comparison of expenditures. Now, we used to have a basic expenditure report, and this one actually does, once it goes through the adopted budget, the revised budget, and the expenditures, and it goes through by categories, not division. However, the previous report I just referenced, which is the statement of expenditures and revenue, that goes by division. So if we look at this one just for expenditures, you see that we have commodities, which includes things like utilities, medical supplies, which are drugs, and other medical supplies. We have contractual services, which includes professional services, interpreters, temporary contractors, medical services. It includes, you know, security, garbage, there's many different things under contractual services. And then it has the capital outlay, which you'll see 15,800. That was the EBO remodel. And that brought us to an expenditure total of approximately 4.4 million. And it gives a percentage of the remaining budget. So you do have it broken down very similar to the expense report we used to have. Now, if you go to the very last report, which is the combo, the statement of revenue and expenditures, once again, you will see on the top of that report, the revenue that we spoke of in the previous report, the 1.59 million. It shows the licenses, the grant payments, and the miscellaneous charges for services, and then it goes into the expenditures. And it does break them out by division. And I know John had asked about looking at expenditures by division. Of course, it doesn't give percentages, but it does take that expenditure that was on the previous page and it breaks it down by division. So you can see health, the health administration, emergency preparedness, environmental health, under personnel, under benefits, under commodities, under contractual services. And then it does give you total expenditures, and then it gives you the expenditures over revenue. Now, keep in mind that I did mention that we have over 800,000 sitting at the county that has not been deposited, and we have over 2 million in grant checks here that have not been able to be sent down to the county. So if you're looking at that number where we have over, you know, we've spent more than we've brought in, it's not all deposited yet. It's still in limbo due to D365. So I hope I didn't, overcomplicate this, but I just wanted to go through these reports. Denise, can I ask, what did I miss?
I think you got it all, Elizabeth. The one thing that I want to mention is going forward, we could present the reports on a monthly basis. We could give you a clear snapshot of what we did in January, of what we did in February. But going forward, we are going to have to give you a cumulative type report. It's going to be for the period ending March 31st. It's going to be for the period ending April 31st. It's going to be cumulative. So we're really not going to be able to compare it to what we did in the past. I think that's the only thing.
Can I please ask that everyone mute their phones? Can everyone please mute their phones? Thank you. Sorry, Denise.
No, that's fine. I'm sorry, did you catch that stuff?
Yes.
Excellent. I think that was the only thing that Elizabeth really wasn't able to touch on.
So I guess we're looking to see, are any of these reports something that the board would find acceptable? Obviously, you don't want to get 5 reports. I don't want to be given 5 reports. So, how can we maybe mash some together, do some changes? I guess look at these. If you have any questions, you're welcome to give me a call. I can go through how they got the number for technical services or whatever you want to know about these reports. And then we can work with the county as they continue to develop and work through Report Builder. Now, they did let us know, and Denise, correct me if I'm wrong, that they are doing a lot of catch up. And it could be quite a while. They said maybe a month or so or more before they get caught up. And I don't know when Report Builder will be available and when we can get our reports. Sue?
Right, that's correct.
Denise?
Yeah, I just would like to add a couple of things here. We have always been very much on top of the finances. We've always been able to, take a look at our monthly financials. We would monitor our expenses. We would monitor our revenue every single month, and throughout the month. Also, there are general accounting principles that need to be followed. We have audits, both financial and program. And I'm just really concerned with the way the situation is in terms of our inability to look and get reports that we need to monitor our financial status. Additionally, like Elizabeth said, we've got $2.8 million out there that's not deposited yet. That concerns me, and I can assure you the staff at the county are working very hard. They've got a lot on their plate, but maybe they need help, maybe they need additional assistance, I don't know, but we're ending our first quarter of our fiscal year, and we don't have financials to determine our status, and that's concerning.
I think just to piggyback on what Sue said, for our grantors, we're supposed to be doing monthly and quarterly reports to our grantors showing what our expenses are. And we've run into some real issues because we don't know what our expenses are, quite frankly. BMO, our credit card, which we used for a lot of purchases, it hasn't been interfaced to D365 yet, so all the expenses are not linked to project codes. We're having to go through and do journal entries to catch that. It's just a lot of what we're seeing. I think we thought we were prepared for D365, but then the processes they had set in place aren't working quite right, and everything is being tweaked, and it's making our grant reporting very difficult. And we're hoping that no one comes auditing us anytime soon, because it would be difficult to provide them with the information required. So we're kind of at risk there.
Yeah.
Yeah, go ahead, Margaret.
I was just wondering, were you allowed to run parallel systems, your old system with the new system, until you had a chance to turn off the old system?
No, there was no parallel time frame.
Because I used to be in IT, and that's what we used to do.
Yeah, we did that with our timekeeping system as well. We ran a couple of parallels to make sure that it ran properly. And that wasn't done here, at least not that we know of. It probably would have been a good idea to run a 6-month parallel or even a full year parallel with what's at stake here. I don't know, that we weren't part of that decision making.
I do also want to point out that New World, our old financial system, is still in use because payroll is being generated out of New World, and then they're doing journal entries to bring it over to D365 because the D365 payroll module wasn't ready yet. So New World is still functioning.
And this is a county-wide system for every department in the entire county. So we are just one of many that are probably struggling with the same issues.
Yeah.
Well, I guess just look over the reports I provided, and if you know, I would say if you want to talk to me personally, I would completely enjoy that conversation. We can hash over some of the things that are in these reports. If they are not acceptable at all, then you know, we go back to the drawing board with the county and continue trying to find more sample reports.
John Cicero's hand is up.
It was, and then I took it down, but I'll go ahead. Yeah, it's kind of concerning that there wasn't any kind of parallel study there, given the complexity of a financial system for a county this large. But irregardless, I think the reports that we've seen here, I think they probably can be mixed and matched a little bit to give us most of what we need. It would be nice at some point, perhaps through the project codes, to be able to drill down like we used to be able to do, so we know that the reimbursables in the health center, you know, how are they coming in year to date by budget, as opposed to lumping in, you know, fees for service or, you know, federal grants or state grants. That's too large of a pot. We're $30 some million budget. I think you want to be able to get a little more detail on that. So I've got a couple of ideas. I think maybe I'll talk to Elizabeth at some point, maybe next week, just reach out to her and we can have this discussion again, perhaps next month.
No problem. Thank you.
Yeah, Sue, is there a, or Elizabeth, is there a county committee that's monitoring and aware of the issues that are occurring with this new system?
Well, we work directly with several individuals at the county between Emily Perkins and Teresa Pitzker and Karen Hennessy. So they are the ones who we work with a lot. And Denise, I know you work with maybe some other individuals, but they know, and we've worked with them. I think it was at least more than a year process that we had meetings with them so that they knew how our systems work and what our expectations were, not only for receipting and doing invoicing, but also report writing and grants.
Yeah, I have a question for Margaret Tyson. As a county board member, have you all been briefed on how this new financial system is rolling out? Are you aware of some of the problems that they're describing?
Yes, and we did hear that payroll, they did special things with payroll because they wanted the checks to be cut. So yeah, they are aware. Yes.
Okay. All right. Let's hope they get a timeline that's going to be rather short to get them cleaned up. I hate to see us get audited and then not be able to provide adequate documentation. So,
does the Board of Health have surprise audits?
Denise, you want to handle that?
They're typically scheduled, but every now and then we do have surprise commission reviews, people coming in. So, yeah. Or they would give us like a month notice that they're going to be out to go over our records. So it's not unheard of. And I did want to mention that when we were speaking with Emily about the reports to present to our board, Elizabeth had inquired as to what was being provided to the county board. And I think she was told that nothing was being provided to the county board at this point either. So yeah, it's across the agency.
Okay. All right, any additional questions or comments? All right, we need a motion and a second to approve the financial reports, we'll call them.
Moved, Billy?
Well, no, I don't think
there's not a motion for these.
Yeah, are you going to take them back for a few days here or a couple of weeks until the next meeting? These are just to take a look at it and determine what specifically you might want.
Correct.
Yeah, I see that says discussion only.
Yeah.
Okay. All right. Rescind that motion, please. Okay, we'll move on to reports from divisions, and Elizabeth, you can lead off, and please cover any new building things in your report as opposed to under old business.
Could I please get a grande ice matcha green tea latte with 2 pumps of chai and just a little bit
We
of
all
a
get
sweet
split.
vanilla
Oh,
foam.
I think that's me. I'll
Make
take
mine
care of
decaf.
I'm all out of chai. Could everyone mute your devices, please?
Okay.
All right.
So,
I don't have a lot of updates, but in regard to the new building, we did find out today that our outdoor LED sign for the Community Health Center, they are going to start the installation next week on Wednesday. So they have been delayed because of the weather, but they are saying that at this point they are going to move forward, and it will replace the outdoor sign that is outside the Community Health Center by the road and the entrance. And so we are looking for that wonderful addition to our campus. We also continue to work with Leopardo and Kluber and the county to tackle the RTU or the rooftop unit issues that we have been having. And actually things are getting better, I'd like to say, and that I jump on, we have is an app that you can look at the temperatures in every single room from the thermostats. So I do that basically on a daily basis to monitor the temperatures throughout the building. And then we work with maintenance and the other contractors to address any issues that we're still having with the rooftop units. And it does seem to be getting better and better. So that's a positive thing. We are, of course, still waiting for our wayfinding signs, and the snow plowing and they have been very busy maintenance, so that's been very helpful on their end to get our lots plowed and our sidewalks done, because they do realize that we have clinics every day and that we are here on Saturday. So I wanted to say thank you to maintenance for helping with that. Other than that, I really don't have any other updates.
all right, any questions for Elizabeth? We'll move on to Joe.
Okay. Well, good afternoon. As you heard earlier, we're dealing with the loss of a longtime staff member, David Partita, who's been with us since 1985. And give you an idea of the impact, he has a caseload of 79 patients that he's been seeing. So we've been busy with reaching out, contacting them, letting them know, and then, of course, developing a plan to get them in care with a clinician as quick as possible. Myself, my report is pretty self-explanatory. Of course, with 3-year accreditation, I detailed out some of the very positive comments that we've got. They indicated areas of strength that the program has, and that's all contained in the report. The governor, of course, has extended telepsychiatry, telemental health until March 8th. And as I reported last time, legislation is in process to make this a permanent change. And financially for this month, we continue to do well. Deposits up to date are at $96,603.19. And today, another $7,990.48 came in. So we're at mid-month and we're already well over $100,000. So again, the deposits are coming in strong and healthy. Are there any questions regarding the Behavioral Health Division that I could answer?
All right, thank you, Joe. We'll move on to Mary Marigos, please.
Mary is out ill today, but she's not giving me any updates to her report.
Okay, thank you, Dr. Bird. We'll move on to Tom Casey.
I can give you
good
my
afternoon,
report
everybody.
as well.
Oh, okay, go ahead. I didn't mean to cut you off. I thought you were done there, but go ahead.
Sorry. I don't have any additions to my report, but I just wanted to let you know, Mr. Zelko, you did ask me a question about outbreak detection last month. So I
saw
just
that in here.
And I just put that information in there as just for your reference, that how epidemiologists look at excess deaths as a variable of outbreak detection. They'll probably be doing that work going forward, and we'll see data based on those kinds of calculations.
Right. seems to be a decrease in the number of cases. It's pretty dramatic. You'd like to explain what's going on there?
Well, that's also reflected in the first graph I gave you as well for the last couple of months. With the rapid rollout of the vaccine, that's being attributed to that, in addition to the continued universal masking that has been implemented across the country. So both of those things together, surprisingly, the masking and the rapid rollout of vaccines.
Well, that's very good. It's comforting to know that masking works, and unfortunately, we were a little late in the game in some areas with that, but pretty simple way. Yeah, are you seeing a decrease in the amount of flu that's circulating now based on people being more cautious, masking and things?
Absolutely. There's been a huge decrease based on this year. The flu season is still going on, but based on where we were this year as opposed to last year, it's quite a big difference in the number of cases, and that has everything to do with hygiene, social distancing, and masking. And now that CDC, and I can say this with no judgment because I used to work for CDC back in the 80s. They're a political machine as well as a health part of the health industry, and they have changed some of their guidance with delicately putting it, they have less restrictions now on what they're allowed to say to the public. So if you'll notice that CDC is even recommending double masking now. If you're not wearing an N95 mask, which I highly recommend, and I have recommended that for the last 11 months now, they're now recommending double masking because masking actually does work quite effectively in controlling the transmission. So I'm happy to see that they're more free to give the kind of strict guidelines that I think we actually need.
Well, it's a good trend. Let's hope that it continues and doesn't reverse and start another upward leg in this. So thank you for the info. Very informative. Thank you.
You're welcome.
Okay, we'll move on to Tom.
Okay. I just have a few things to add to my report. This week, we sent out the final invoices for 27 mobile units and 56 seasonal food facilities, most of which did not operate in 2020. So we're not sure if we will see those dollars this year or not. We'll have to wait and see. We are currently reviewing our swimming program. Billing season for that is coming up in March. Many of our indoors, I calculated today after checking with the branches, about 36 pool facilities, a lot of them with multiple units and facilities on the premises. 36 of our 136 invoices from last year did not operate in 2020, so they'll be getting a credit for this year. West Nile season's coming up, so we are submitting. We just had our contract approved by our executive director, and we're submitting the payment in for the advertisement for our electronic billboards that will run from June through September. Upcoming in March, final invoices will go out to the owners of discharging permits. Those are still trickling in daily. We're probably less than 950 down, which is pretty good for both being a pandemic year and compared to other years. And finally, one, the weather, and two, we had a job transfer within our division. So we're down to one sampler who had been out on leave. And with the weather right now, with the snow being knee deep, our lab numbers will be down next month.
Okay, does anyone have any questions for Tom? All right, we'll move along to Georgia. Go ahead, Georgia.
Okay, I don't have anything to add to my report, but I would just like to point out that our WIC staff have been working short for several months for various reasons, but the last month they've achieved 101% of their caseload, which I've been told is the first time that's ever happened. So they've been working really hard, and Just wanted to put that in the minutes.
Well, and that's terrific that you're at that high level, because I can remember for many years that we'd be around 80% or somewhere and just not getting it. So whatever they're doing it well. And congratulations to staff on that achievement.
Thank you.
Okay, we'll move on to Katie.
I believe Sue and Cindy were going to update about the mass vaccination response, and there's nothing else in emergency preparedness and response besides that going on. So if Cindy, you wanted to update.
Well, let's wait till we get to the old business. We'll do that under old business.
That works. Thank you.
Okay, thanks, Katie. All right, Steve, you there?
Yes, good afternoon, everybody. Not much to add to my report except just incredible sense of pride that I feel when I arrive every morning and see how hard everybody's working at our clinic, and really the amount of volunteers we have, a lot of them that have emailed me first and I've sent their name on. Great to have such an awesome team. At this time, I'm working on a press release that's going to provide just a bit of an update on numbers and also the vaccine situation as it has been this week. Same routine that I talked about in my report, a lot of media phone calls each day, and also a lot of Will County residents that find their way to my email or to my phone. And I've met some wonderful people who are just glad to learn some more things and understand some things, and I've enjoyed talking to them. So way to go, team, and thank you. I'm so proud to be here, and that's all I have to add.
All right, thank you, Steve. Any questions for Steve? There being none, we'll move on to old business for the COVID-19 response update. Sue?
Yes, hello. You heard of much of what we're doing and some of the parts of the initiative through Cindy's response to questions earlier in the agenda. But I will just kind of go through some of the information and numbers that I had gathered for you, and I do have a couple of additional updates. So far in Will County, we have provided 78,000 vaccinations, 21,000 people fully vaccinated, and that's about 3% of the population. This week's Illinois allocation, it was at a siren that we received earlier today. That's an electronic notification system from the state of Illinois. There were 365,000 doses that were allocated to Illinois this week from the manufacturers. This week alone, Illinois has only received 55,000. So we are in the same boat as many other health departments across the state, and I'm sure it's the same in other states. So instead of us receiving 365,000 throughout Illinois, we've received 55. We had an internal meeting earlier today. At that time, we had not yet received information about whether or not we would still receive our allotments this week. And we have had to, really look at this very critically about the logistics on getting, first dose and second dose to the right people. So it's really kind of turned out to be a logistical nightmare. In Illinois, there have been 2.5 million doses received, and so far 1.9 million doses administered. So for the amount of vaccine that Illinois is getting, we are using it. We are getting the shots in the arms. We just need more. So over the weekend, I believe it was Saturday or Sunday, the Illinois Department of Public Health, they sent out the newest version of their mass vaccination plan. That new version, it's 6.0. It's on our website. What it did is further kind of branch out phase 1B. It also has some links to some updated information from CDC. It also has some language in there about the EMS staff expanding their scope of practice so that they are able to administer vaccines. And then they also have some reference material from DHS in terms of caretakers and personal home health individuals. So if you wanted to read the whole document, it is on our website. Our call center is very, very close to operating. They actually have some staff working right now. They are getting trained on the systems. They are getting trained on the FAQs and on our processes. And we hope to be rolling that out to the public very, very soon. Our M-Track that we beta tested last week, that's the scheduling system for the public, that we beta tested last week and went well. And so this week we are internally scheduling some of our vaccine or our clinics to, again, further test it. We cannot roll it out countywide yet because we just don't have enough vaccine to open up a lot of slots for appointments. This week we brought on a couple of new staff. We now have a manager for community partner engagement. Her name is Carol Ricken, and she is going to help us try to reach the sectors and the cultures and the ethnicities and all the different communities within our county to make sure that we are reaching everyone and getting them information as we work through the sectors in the phases. Make sure that we're reaching out to the proper trade organizations or chambers of commerce or employers or whomever it might be to make sure that we're doing a good job with our outreach. We also brought on an individual that's going to be overseeing the call center and clinic as our operations manager. She has a lot of experience being an operations manager, so she will be able to help us coordinate all of that much better, be able to take a kind of an outside look at what we're doing and provide us with some information and her expertise on how we can improve things, both internally, externally, and at the clinics. So we're happy to bring those two individuals on, and of course their skill sets. As Cindy alluded to earlier, EMA is working very hard on securing the large mass vaccination sites throughout the county. They were supposed to go visit a site yesterday, and because of the snow, that was canceled, so those are being rescheduled. But what we're trying to do is get those set up, get them supplied, get them manned, and be ready to go so that hopefully in mid to late March, we have enough vaccine to roll out a truly very large vaccination clinic. So that's, that's it in a nutshell. Our comms firm, as you know, we were working with the county executive's office, and the county board also approved an expenditure for us to work with a communications firm. Right now their contract is being reviewed at the state's attorney's office, and as soon as state's attorney is okay with the language, then we will move it forward and bring them online, hopefully maybe later this week or sometime next week. And this firm will help us and assist us with providing good messaging, strategic messaging in different mediums, internally, externally, to all different stakeholders that we deal with. So we're really looking forward to that.
Sue, can you talk for a moment about the contact tracing program and what you're finding activity-wise with the efforts of this group?
Sure. The contact tracers obviously are still operating. They have been working with our public, our institutions, our long-term care facilities. That CD staff have been working very hard since February of 2020, and they continue to do that. At one point, we had about 116 contact tracers. I think we are now down to about 90. And I just took a look at a notification that Alpesh had sent earlier this week. Alpesh Patel, he's our CD coordinator. Our contact tracers have been successful in contacting about 50% of the individuals that are needing to be contacted. And it might sound like that's not a lot, but really that's a little bit higher than the state average. I think the state average is around 48 to 49%. I can't really speak today to what specifically they're still finding. I don't know if Alpesh might be on the call. I think he is. Alpesh, would you like to give maybe a little update on the kind of the day-to-day of the contact tracers?
Well, they're doing what they are supposed to do, which is, trying to get hold of each and every case within 24 hours and make sure that they put them into the isolation and identify any contacts. People are not following a lot of guidelines, and that's the biggest struggle. And now suddenly everyone is forgot that the COVID is still spreading, and the talk of the town is the vaccine, and nobody pays attention to that. We should be not giving up all those measures. And unfortunately, when the new variant starts circulating, it will be back to square one if people do not pay attention to all these restrictions that we are still putting. So contact tracers are keep reminding everyone, as well as putting people into the monitoring, but they need to understand that it goes on and on until we have a meaningful down into the numbers. So we'll continue our efforts. Even though the trend is down, doesn't mean that it is to the level where we can let people continue their routine activities. And it could be a surprise down into the spring or into the summer if people do not follow all these restrictions. And the efficacy of the vaccine against the variants is still a question mark. So we'll see how it turns out. So contact tracing will go on for significantly longer period of time.
Alpesh, we heard a lot about the Super Bowl super spreader events. Are we past the window when that would have occurred, or are we still expecting to see a significant change in the number of cases due to the Super Bowl?
Well, we are not out of the window yet. Plus, a lot of people are still not back. Traveling was hampered with the weather condition and everything. So the number we see does not really represent the true number because of the weather condition. And a lot of people are not getting tested in timely manner either. So next 2 weeks, we'll see how numbers look like, but weather do affect a lot into the daily testing as well as daily reporting of the cases. And especially last, few days, we had a whole bunch of weather related issues. So next 2 to 3 weeks will tell us where do we stand in terms of all these events and travel and people are going out of town, coming back.
Okay. All right, Margaret, I see you have your hand up. Go ahead, please.
Yes, I have 2 questions for you, Sue. What's the Carol Ricken's title, and the call center manager, what's her name?
Okay, so the call center operations manager is Christy Cage.
Okay.
And the title for Carol Ricken is Manager Community Partner Engagement.
That's a mouthful.
Yeah.
Thank you.
You're welcome.
Okay, any other questions for Sue on our COVID response? Okay, we've already covered the new building update. We'll move on to substance use treatment program, Dr. Trioni.
Okay, our new program manager started on January 11th, Bill Carmia. He's been involved in orientation, both county as well as the division, and completed learning the various systems, especially our record keeping information system. We've gone on to we're utilizing the tool of Teams to establish a state of Illinois license preparation group. This is a project management system within Teams. It provides timelines, responsibilities, products, as well as deliverables. And the program has been established to help in the development of our policies and procedures. The state of Illinois requires 42 specific detailed policies and procedures. 7 have been completed. These are policies that need to be researched, developed, and written. And we're projecting the submission of the application to the state of Illinois for the substance use program to be in mid to late March. So that's the timelining. We're literally having to start from scratch. And at the same time, we're dealing with all brand new standards that the state has put out. But it's been a good exercise. And of course, we're crosswalking this with the CARF standards so that when CARF rolls around next time, we have everything pretty much in order and synchronized.
Okay, any questions for Joe? Guys have done a good job ramping that up pretty quickly, Joe. I congratulate you on that. Thank you. Okay, we'll move on to new business. Wait a minute. We'll move on to new business. And as a point of clarification, I just want to talk a little bit about Resolution 2110, IDPH Max Vaccination Grant, and Resolution 2114, appropriation of county CARES funding for mass vaccination efforts. Normally, we are unable to identify a lot of funds for things that we are charged with doing, and here we are fortunate enough to have two funding sources for max vaccination. The county has come forward with some money from their CARES funding, and there were several meetings last week at the county to discuss levels of funding. The Resolution 2110, the IDPH grant, we did not have an opportunity to review at our special meeting, and the county in their meetings on the CARES funding didn't have this grant on their radar either to look at how the two would link together and complement each other. So I asked Sue this morning to reach out to leadership of the county board and county executive and ask them if they were comfortable with us moving forward with both, since they're not coordinated, or whether they wanted us to defer on the county funding and let it go back to committee, or whether they were comfortable with us moving ahead with both initiatives and then work out how they interrelate as we're in the process. I know it's extremely important that we be ready to provide the vaccine, and but I don't want to offend the county, and due to a lack of transparency, they would say later, what's this grant? Why didn't we know about this? So that's where some confusion came in today, but we will start with Resolution 2110. Mike, I know you have some comments. Do you want to make them at this time, or do you want to wait until we get to Resolution 2114?
I can wait till 2114.
Okay, very good. Appreciate that. Okay, you see the budget for the IDPH grant, and I would entertain a motion to approve Resolution 2110, the mass vaccination grant from IDPH.
Billy Carroll, move.
Ryland, second.
Okay, we have a motion and a second. Any further discussion on the Resolution 2110? All right, call the roll, Stephanie, please.
Mr. Zelko,
Yes.
Dr. Terrell,
Yes.
Mr. Cicero,
Yes.
Mr. Gould, I think he hung up. Okay. Mr. Hertzman,
Yes.
Ms. Mackey,
Yes.
Dr. Ramos,
Yes.
Ms. Ryland,
Yes.
Ms. Tyson,
Yes.
Dr. Soderquist.
Yes.
Roll call is complete.
Okay, Resolution 2110 has been approved. We'll move on to Resolution 2111, HRSA hypertension grant appropriation. And I'll entertain a motion and second to approve that resolution.
Mackey, I'll make the motion.
Second, John.
All right, Sue, do you want to address the funding here and what it's going to do? Pretty self-explanatory, I guess.
Yes, certainly. As you can see, the majority of the funding is either medical supplies and or a FTE for 36 weeks plus fringe. This particular full-time salary is actually supplanting a position that's already budgeted in our budget for fiscal 21. So this is, it's a small grant, but it will help us to identify this particular population and work along the deliverables here that HRSA has set out.
Okay.
Okay, any additional questions? I hope I'm going to do this right, but I'll entertain a motion and a second to use the previous roll call.
Motion, Hertzman. Second, Cicero.
Previous
All in-
roll call, Tyson.
Okay, all in favor of using previous roll call signify by saying aye.
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 I didn't hear anything from, I'm sorry.
I think because we're doing virtual, we still have to do a roll call, even if we're going to do that.
We do it at the county all the time.
Okay, good enough then. Sorry.
Okay.
Yeah, just make sure you get the nays too.
Oh, I'm sorry. Yeah. Okay.
And we're monitoring to see, make sure no one has hopped off the call. Make sure that the attendance is still current.
Okay, resolution 2112, NCCHC appropriation. Entertain a motion to approve 2112.
Move, Terrell.
Second, Ryland.
Okay, it's been moved and seconded. Sue, do you want to explain this briefly, please?
Sure. This is a grant award for a little over 24,000, basically to help enhance our telehealth capabilities. So Mary wrote for the grant, and we were granted it, and this goes really only through March of 2021. So it's a very short, small grant.
Any further questions for Sue? Okay, I'll entertain a motion to use previous roll call.
Move.
Mackey, I'll make that motion.
Second.
Second.
I have Billy Terrell and Tina Mackey.
Okay, it's been moved and seconded to use previous roll call. All those in favor signify by saying aye.
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 Opposed? Motion carries. Okay, we have resolution 2113, approval of new hospital codes and COVID fees. I need a motion and a second to approve resolution 2113.
Motion, Tyson.
Second, Terrell.
Okay, Sue, has this been approved by the governing council?
Yes, it was brought to them at their last meeting, and it was approved.
Okay, any further questions? I need a motion and a second to use previous roll call.
Move.
Ryland.
Billy
Second,
Terrell
John.
and Nancy Ryland. Nancy, did you second?
I can second, yeah.
Oh, okay.
All right, it's been moved and seconded to use previous roll call. All those in favor signify by saying aye.
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 Opposed? Motion carries. Okay, we'll move on to resolution 21-14, appropriation of county CARES funding for max vaccination efforts. And let me get a motion and a second, and then we'll have our discussion.
Moved.
Ryland.
Second, Tyson.
Okay, it's been moved and seconded. Mike Frickalone, County Board member, would you like to address the issue, please?
Sure. First, let me say that, for the past 6 to 8 months, the county board has certainly been there for any needs of the health department. We've communicated on many occasions, whatever you guys need, let us know. There's CARES Act money. We defederalized the money at the end of the year, but that money's still there, and we've asked many, many times, what do you need? And there were some small needs of PPE and other things which we moved CARES Act money for. The county executive then took an initiative to push ahead with the call center so that we could get it going as fast as possible. And the county board concurred with that and approved that. Then in our last several meetings in this next group of money, the 21-14 resolution, we were given a sheet. Sue gave us the sheet, and you said in there, Sue, that you needed $150,000 for clinical supplies and $750 for staffing and $1 million for clinical staffing medical and $252,000 clinical staffing agency non-medical. And there were a lot of other needs in there, but just those ones I quoted are over 1.75 million. They're more like 2.5, 2.25. We moved forward with this $3 million from the county based on all these needs. But then as the letter today states that you don't need the money because you've got the 1.75 coming in, although you also stated in the letter that you're anticipating that money, but it hasn't been approved yet, and you may not see it for a couple of weeks. I mean, I don't want you guys to get in a situation where we're hiring people until we're at critical mass again, like we did with the call center, which we probably should have started some time ago. So I don't understand why now this money isn't needed because you are anticipating in the next couple of weeks to see 1.75. Aren't we moving at the health department, moving forward with hiring the RNs and the CMAs and all that support staff now so that we're ready when that vaccine influx comes in? On the county board, our agenda tomorrow, we have a resolution to move this money, to approve this money. We're probably changing the resolution now to say it's a loan, because if you don't feel you need the money, you can give it back to us. But we want you to move forward with these things that you said you needed badly. And if you do, you need them now, not 2 weeks from now when hopefully your money comes through. So I'm a little confused based on the information this morning on why, it's not like we're trying to force you to take money, but why you don't want it at this point, when we're moving forward to approve this resolution tomorrow.
Yeah, Mike, it isn't that we don't need the money or we don't have a use for the money. The opportunity that came up with the IDPH grant was not on the table when it was discussed. And I just wanted to be sure in a very transparent method that the county board was made aware of the second grant and whether you all wanted to take this back to committee or whether you're comfortable moving ahead, and we'll figure out the logistics of how these things mesh together while we're hiring the people and spending the money and giving the shots. It was never that we didn't think we needed the money. It was affording you an opportunity as county board to take a look at the impact of the second grant. And if you all are comfortable with moving ahead with it, then I have no problem recommending this be approved at this point.
Well, again, I think we're changing the resolution tomorrow to say it's a loan, so you can draw off of it as needed. You don't have to automatically take all $3 million, but if you need an extra $250 to start hiring these people, you'll be able to draw off of that, and it will be a loan. And again, Browner, our consultants, are telling us that almost all of this stuff that you're planning on doing is going to be FEMA reimbursable. So we need to make sure that we're doing what we need to do at the health department to follow the FEMA rules so that we can hopefully apply for that, get that money back, and then that money can come back to the county and not, put it back in our coffer so we can use it for other initiatives, be it housing or something else. But
Right.
I think if we move forward with the loan at this point, if you need it, fine, it's there, because if we don't do that tomorrow, we can't do it for another month until unless we have another special meeting, which obviously we don't want to do. So I think if we do it as a loan and you accept it as a loan at this point, maybe that's the best way for us all to move forward.
Well, and I appreciate that. I mean, again, we don't know exactly how much money it's going to cost to do all these things. And having a backup of an opportunity to tap into a source of money first earlier than what the IDPH grant will be available, and then to be using it as a backup as we're running short. The state may or may not have any more money, but having the county's money available to tap is going to serve the citizens of Will County in numerous ways, getting started quicker and being able to carry on longer and do what we need to do. So I'm ready to move ahead with this. I see John has his hand up. John, go ahead.
Yes, hi, Jim and Mike. I'm totally supportive of the drawdown concept. I think that's the way to go. Should you need it, it's available. You draw down what is needed. It's a better model than taking possession of all the cash and then finding out that you don't need it and then figuring out a mechanism to transfer back. Drawdown, totally supportive. I think that's the best model.
Good, because like I said, if you need to start hiring people, let's not wait 2 weeks till you get the IDPH money. Start hiring them now so that we're ready for that next wave of double doses that we're going to get or increased doses. So I think the county board will be in favor of that. We've got our caucus a little later this evening, and that's what I'll be talking to them about. And I know the speaker had to drop off, but she and I talked this afternoon, and I think she's in favor of going that route as well.
John has his hand up too. John Cicero.
I'm sorry, that's done.
Oh, okay.
I'm good.
I just want to make mention that there is a revised, there is a resolution that Stephanie is going to put on the screen so that you all know what you are looking at. We had to change the title of the resolution and a little bit of the verbiage since it's now defederalized funds, it's not CARES funds. So Stephanie, if you could please put that up and share the screen, please. The other item on here, if you look in on the second page, the revenue code from and to, we're still working with that with the county finance department. Again, D365 issues, but you can see specifically the language there and then the different actual expense lines that will equal the 3 million.
Can you see?
Yes.
Yeah. Okay.
Yeah, I can see.
Do you need me to scroll up or down or?
Why don't you leave it right there for now and then let them read it and then we can go ahead and move it in a second.
Let me make sure that I have everything on the page. Well, you can't see the bottom, so I'll do that.
Where it says, whereas the award of 3 million, do we need to clarify that? Whereas the loan of 3 million?
Dan McGrath, could you weigh in on that? I know that since it is going into or it could be going into our budget, it's It is an appropriation, but I don't know if we need to change that to loan. Dan?
Sorry, this trying to unmute, it was not working. Can you hear me?
Yeah.
Yeah.
I think if you changed it, that's not an issue. I think the fact that it says award is not going to make it invalid. So I think changing it would be more accurate because the county board resolution is going to be a loan, and it is going to be a loan. So you can amend it to read that way, and I think that would probably be better, but I don't think it's mandatory.
Okay.
Can we approve this resolution pending on wording being changed to be consistent with whatever the county board is going to pass?
Yes, I would pass the resolution with the amendment on its face to use the term loan instead of award.
Okay.
Okay. All right, Mike, that sound good to you?
It does. And again, not to say that the loan isn't forgivable, but if you have money that you get and don't need this money, then it just kind of stays with us.
Right, right. So it'd be a kind of a drawdown, as John Cicero
Right.
said, as opposed to just dumping some money in there. Okay.
Yep.
We need to understand that the two budgets have very similar items. And if we buy all the computers out of your budget with the county money, we'll have to change the other budget to reflect that spending being done elsewhere. So it's going to be a little trickier maybe than it would have been with just one source, but we can deal with that, and we will manage it properly, and are very appreciative of the help from the county.
We're here. That's exactly why we're here, to help. Same thing with the executive.
Very good. I think we had did we do a motion and a second on this already? I think we did.
You did, but now
Okay.
I have to call a roll because Paul Hertzman left.
Okay, all right. But the motion needs to reflect the wording being consistent with the county resolution with respect to the term award being loan. Is that, we're good with that?
Mm-hmm.
Those of you that made the motion and the second, are you good with that revision?
Yes.
Okay, then any other questions or comments? Let's go ahead and call the roll, please.
Mr. Zelko?
Yes.
Dr. Terrell?
Yes.
Mr. Cicero?
Yes.
Ms. Mackey?
Yeah.
Dr. Ramos?
Yes.
Ms. Ryland?
Yes.
Dr. Soderquist?
Yes.
Ms. Tyson?
Yes.
Roll call complete.
Resolution 2114 has been approved. Okay, we'll move on to item F, vacation time loss. Sue, go ahead and handle that.
Yes, thank you. I wanted to bring this to the board's attention to kind of let you know what's happening and let you know about some of the inquiries that I have received from members of our management team. Since this department has been responding to COVID since February, we have had many of our managers not be able to take any time off. And I'm serious. It's not just a matter of, oh, I got work to do. No, they have not been able to take time off because they constantly are emailing. They get, I don't know why I'm getting feedback. Okay. They're constantly being, emailed and phone calls, and some of this is, critical and crisis things. Before I went through the work to a lot of information together, I first wanted to kind of get the feel from the board as to whether or not you would want me to move forward with this. I've had at least 6 of our managers request either a payout of their vacation accruals that they lost or an extended time frame for them to get those accruals back and be able to use them. So how it works with our vacation time is that you get to a certain cap, 225 hours of vacation time, and that's all you can accrue. If you have 224 hours in your vacation accrual and your allotment comes around to get your vacation time and you have 224 hours, you get 1 hour. So in some cases, they're losing 11, 13, 16 hours of vacation time every month. The last time I tallied this which was honestly a couple of months ago, because I just wanted to get a feel for where we were. We had at least 300 to 400 hours of lost
Because they were
vacation.
barking at me, I had to feed them. Because I was on this meeting.
300 to 400 hours, 300 to 400 hours of staff who've lost vacation time. That's time they'll never get back. And so I just wanted to bring it to the board. I promised that I would. And I had a suggestion. I thought perhaps we would be able to give back their allotments and then provide them with a reasonable time frame to use the allotments that they lost. So I just thought we would talk about it as a board and discuss it.
This is not unlike what we did with the grievance, where all they wanted was the time back as a personal day, and it was at no cost to us. And I see this as very similar to that, in that people are losing time because of demands of the job during COVID. And I personally would have no problem. What do you think? You recommending maybe a year to use the days, or?
Yeah, anything less than a year, and maybe we even look at starting it in not even now, but in a couple of months, because we're still dealing with COVID. I mean, people still can't take vacation time. And so I don't know if we start this, we start the clock maybe in either now and give them a year, or we start the clock in 3 months and give them a year. I don't know. I just would like some feedback and some sentiment, and see what you all think. But giving them a 3 months to use 160 hours, and we do have some managers who have lost 150 or more vacation hours. They'll never be able to use it in 3 months. I mean, they still have work to do. So we would need to extend the time frame for them to use this bank to a reasonable amount of time. And I think a year is a reasonable amount of time.
I agree with
Hi,
you.
Jim. It's John. It's John. Oh, I'm sorry. I would
Go
be
ahead.
supportive of those folks getting their time back that they lost, and then establish the time period as a minimum through the end of the calendar year, and perhaps, even a few months beyond that. But I think they should be made whole on what they lost.
I agree with that, Sue. I think it's one of those things where it helps morale, and I'm sure you're not the only ones that are dealing with this now in terms of COVID and staffing. It allows people enough time that they know that that time is coming, even if they can't take it right now.
Yeah.
Yeah. So that sounds reasonable to me.
Well, I very much appreciate the support. What I can do before the next Board of Health meeting, if you'd like, is to get a more current, number of hours that we're talking about and number of individuals. And then that'll give you a really good idea of truly what we're talking about, and then maybe make a decision then as to, when we start this and what that time frame is for use. Does that sound okay?
Sounds fine.
Yeah, I would look at a little longer opportunity to use it, maybe 18 months. I mean, if somebody's got over 130 hours they've lost, they're in the next 8 or 9 months, they're not going to get to use that.
Yeah.
So if we're going to do it, let's extend it out far enough to where it's reasonable to expect that they would be able to use that time.
Okay, all right.
Ms. Tyson has her hand up. Go ahead, Margaret.
Thank you, Stephanie. Is there another option? Can they have is there a cash option that could go on the table as well?
Well, some people have requested that. They've asked to be paid out. The problem there is we don't have that money in the budget to actually pay them out unless there was a way for us to pay them through, I don't know, some of the funding that we're getting. I mean, that would probably be the preferred method for most of them. But we've never done it that way.
I think what Margaret, are you asking if they could temporarily raise the cap from 225 to say 325 or something? Was that the question?
No, the people, instead of taking that vacation time, can they opt to get cash instead?
Oh, I see. Okay.
A payout.
I see a payout. Yeah, that's tough. Yeah.
Could there be a limit
I
set
did-
on the payout? You know, 10% of what they have. So it's kind of a mix. You can get some payout. It wouldn't overburden the budget.
Well, the problem is I don't know where I get the money to pay them out. I'd have to look at what those possibilities are. You know, when we build the budget for 21, you know, we have obviously, you know, the salaries, overtime, although our managers don't get overtime like that typically. So I'd have to research where I could get the funding to do this.
I would prefer the ability to use versus trying to pay it out. I don't know.
We've got a couple.
I agree with that. I'm thinking that they need the time away as well. Paying it out and them still working the hours they are is not going to create a healthy atmosphere. So it may be in their best interest to leave it, knowing that they can use it. And I actually agree with Jim that maybe it should be extended more than 12 months, maybe 18 months, because we're going to deal with the pandemic till at least the end of this year. Maybe at the same level that it is now.
Mike Frissalone has his hand up.
Go ahead, Mike.
Yeah, Jim, I just want to mention something you might want to think of for the future too is I'm sure you've had some revenue loss with, you know, some of the programs and stuff that you do, not bringing in the revenue that you normally do. And, you know, the next CARES Act, American Relief Act, whatever they're calling it now, they're talking about revenue replacement in that act. We're potentially slated to get $130 million from what we're hearing anecdotally right now. And that would include revenue replacement. So there may be some money coming for revenue replacement that may give you the ability to pay some cash out. So just something to think of for the future.
Oh, that's a great suggestion. I think we should monitor that, and Sue can put a value to it. That'd be great, because I know the worst thing you can do is somebody is really busy and then say, no, you got to take time off, and they don't take it off. I've been in that position myself, and John and everybody has. And to think that we might have the ability to pay out some of this money, that would be a nice thing. Although the mental health rest that people would not get, maybe money makes that feel better. I don't know.
Maybe a combination.
Maybe a combination. Yeah.
John,
I like that. Good.
John Cicero has his hand up.
Revenue loss from
Yeah,
last
that's
year.
what I was going to say. Perhaps the board can approve the extension of the usage through, let's say, fiscal year 22. So November of next year, and some type of payout should this money materialize. So extend it till next November of 22. You could do that now, and then talk about the idea of, you know, compensation should money surface. But at least that way they would come away with knowing they've got plenty of time to use it up.
Yeah.
Good. Oh, that's great. I'm glad. Who else? Anybody else?
Margaret Tyson, did you have your hand back up?
I'm sorry.
Okay.
Yeah.
Okay. I think that's
thank you very
everyone.
much. I will share this information with our management team. They're going to be very happy to know that you were supportive and that you were allowing me to take a look at this. I'll come back next Board of Health meeting with some current information in terms of how many managers this affects and how many hours this affects. So,
And please convey to them that the Board of Health is very appreciative and grateful to them for their dedication and the work that they're putting in over and above. I know there's no 8-hour days here. It's every day, it's 3 o'clock in the morning. And, it's a very difficult situation, and the board recognizes that and is willing to take this step to compensate them, whether it's additional time or money's become available. But they're doing a great job. You all are. And this is the toughest thing this department has probably ever had to work with. And your staff is dedicated, and we thank them.
Very much.
Thank you.
Okay, executive session. We have no need for executive session. Personnel status report. We didn't eliminate the tracer program. They have been transferred over to an employment agency, and it kind of fooled me when I first saw it. I thought, oh man, all these people quit or fired. What happened? And they are still working, but under our direction through a employment agency, right, Sue? Isn't that what you told me?
yes, we transferred them to a temp employment agency. So we had to make sure we cleaned up the roster formally. So we had to bring it to the board for their terminations.
Okay, I'll entertain a motion and a second to approve the personnel status report.
Move.
Second, Riley.
Okay, moved and seconded. Any further discussion? Okay, I'll entertain a motion and a second to go to previous roll call.
Matthew, I'll make the motion.
Second, John.
All in favor signify by saying aye.
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 Opposed? Motion carries. Okay, board member concerns and comments. I just want to mention that the committee, the special committee to oversee the COVID-19 response will be meeting next Wednesday at 3 o'clock virtually as we're meeting today. And one of the things, if there's anything that comes up between now and then of an immediate nature that needs action, this committee will be taking action on it and bring it to the board in the March meeting. The committee is to expedite, get things done quickly so there's no lag between the need and meeting the need. And we will trust that Sue will bring us anything that needs immediate action. So all of you board members who wish to attend, please, Stephanie will send you the link and feel welcome to attend. That's my comment. So any other board member concerns or comments?
None other than thank you to the health department, to her team, all the directors, all the divisional directors for all the good work they're doing. There are not enough thanks for all that's being done.
Thank you. I will extend that to all of them.
Please do that.
Okay, and then we have general public comments and concerns. Anyone wish to say anything? All right, there being none, we will move on.
I'm sorry, Tanner Simeon has his or her hand up.
Okay, go ahead, please.
Thank you so much. Yeah, so my name is Tanner Simeon Cox. I'm one of the organizers Southwest Suburban. I'm actually going to give it just a second because I hear an echo. Okay. I have a couple of questions that are both directly related to transparency and accountability from the health department to the community in general, but more specifically with the vaccine rollout plan and an equitable vaccine rollout plan. I've been looking at the data on the vaccine in Will County. versus the community.
Tanner?
Yes.
Okay, we're kind of losing you.
Okay. So I've been looking recently at the data that's been released around who is receiving the vaccine versus the communities that have been most directly impacted. Depending on the source, there's a disparity of between 3 and 8%. But just using IDPH's data, we see that folks who self-identified as Hispanic or Latino represented approximately 18% of confirmed cases in Will County. But the same community only is representing currently 10% of the vaccines. Similarly, folks who self-identified as Black represented 9% of total cases and only 6% of current vaccines. And I'd like to know sort of what the health department is planning now that this data is released to do in a response to this disparity and help to organize an equitable distribution.
I guess I can take that question. So we are in the process and we have reached out to several groups and we'll be working to plan to specifically be targeting our Black and Brown, our Latino communities with mass vaccination efforts moving forward. We've recently hired somebody that's going to be leading this effort with the mass vaccination campaign.
I appreciate and my follow-up question also has to do more specifically with transparency in the community at large. We recently hosted one of our regular community meetings at SSIP, and we've also been running a survey through our membership about the vaccine. We see that there's still a lot of uncertainty, a lot of misinformation. Folks have mentioned they aren't confident that the health department is going to be able to address this big issue if equitable translation services aren't even currently being provided. And community members are also, fearing that personal information may be shared, other things like that. I know other organizations may have had different experiences, but at least where we are in Bolingbrook, Romeoville area, there seems to be a huge information gap that isn't really being addressed. And one, we would like to see that addressed clearly from the health department. And we would like to see that steps taken to address those needs. I know last meeting we mentioned that we had reached out to have somebody guest present at our community meeting, and we never heard back. And so I think that there are a lot of issues right now that are going on and that need to be addressed.
Well, and so that is one of the reasons that we scheduled that meeting on Friday with your organization and the Spanish Community Center, so we can address the needs of your community, the current concerns that you have. We have every intention of rolling out an equitable plan and making sure that we get vaccine to all the different affected populations. We're currently working on looking at data from the survey that we did and populating it with vaccine data to find out where are we not getting the vaccine from the community applicants that have filled out our survey that want the vaccination. So there's a lot being done in the background and we are in the planning phases, and I do look forward to meeting with you on Friday.
Definitely, Cindy. And like I said, we appreciate it. And I know I look forward to meeting with you as well. I'd also like to hear from Sue directly as well, if she's able to contribute to this. Because again, I totally, and my organization hears and we understand and we respect the difficulty. Just even the vaccines that aren't being delivered to the state is a reality that we're all having to deal with. But we believe that we're missing out on a huge opportunity to actually engage with the community in Will County. And we don't see that coming from the top at the health department.
Yeah, thank you, Tanner, for your concerns. I can assure you that that is a top priority of ours, and working with you and your organization to help us figure out how to do that is what we need to do. We don't know the detail. We don't know the level of whether it's mistrust or whether it's misinformation or whatever it is. We don't know what's out there. So we have been talking about doing this for quite some time. That was one of the reasons why we did hire this new person. She came on board yesterday. As Cindy mentioned, it is a priority, and she will be assisting Cindy at the meeting with your organization on Friday to gather information and to try to find the best way to work with you and the other communities. And it's not just, the Black and the brown community, Latinx, we have Korean, and we have, individuals from many other communities that we have to reach out to as well. But what you have to understand is we don't necessarily know how to do that. So if people come to us and say, hey, how can we help you reach our community? We're there. We're ready to help. We just don't always know that inlet. So I'm so happy that we're meeting, and I'm sure that we'll be able to reach the communities and get the information out there.
For sure. I appreciate that. And that's definitely something that we have in mind. Whenever we say Black and brown, that encapsulates the Asian community as well in the area. We have
Asians, we have Polish, we have Russian, we have a lot of different people we have to reach. And they all have similar needs, and they all are important, and we're really trying to wrap our head around it. So we appreciate your help in helping us reach that community.
Of course. And I know we mentioned this last meeting too, but we still think it's a priority. The interpretation and translation services, it was alarming to hear that only $2,000 was allocated towards that, and I saw that's potentially increased to $5,000 in the new budget, but that's still when we're dealing with all these different language groups, it's still a very
one of the things that we're looking at, we're talking about partners in the community, and when we make partners in the community, partnership is two-way. So we expect some of our partners to also volunteer and help with those kinds of things as well. So maybe somebody from, your project or the Spanish Community Center can help with translation. So we don't have to pay a translator to do the translation. And it's not potentially 5,000. I did up it to 5,000. So, we're going to try to do everything we can to help reach all these different communities. But like I said, we need individuals from those communities to help us help you.
And if I can push back just a little bit with respect, we love to help reach out to the community, and we love interacting with our folks. But at the end of the day, our jobs are not to be translators just for any old things. We engage in the community and we help spread information as often as possible. But that we step in when systems fail, and that's sort of the space that we occupy. And we would like to see in this case the system really stepping up and serving the community that it's been chosen and taken on the responsibility to serve.
I just want to mention that we do and have the ability to do a lot of translation internally. We have procedures in place, and they've been working quite well. So we have a lot of free ways to translate documents. We have a lot of talented staff that we have been tapping into lately for all the work that we've been doing to translate everything into Spanish. The things that we would pay for to get translated would be some of those larger documents that will take much longer to translate. The smaller social media, things like messaging like that, that's all stuff that we can do internally free of charge.
Sure. I appreciate your all's feedback, and I definitely look forward to continuing the conversation between the health department and our organization.
Thank you.
Okay, that will be one of the things that we'll be monitoring at our committee level also, that meets between board meetings. So we'll be keeping an eye on it from the board and assure that it's continuing to move forward addressing those needs. So anyone else have any comments? All right, I'll entertain a motion to adjourn.
Move, John.
Second, Tyson.
All right, we have a motion, a second to adjourn. Previous roll call. I guess I need another motion and a second. Or Dan, can we do previous roll call with what I've got?
I don't know what you mean. What do you have? Did someone leave?
Well, I have a motion and a second to adjourn. Can I just say
Yes.
previous roll call, or do I have to do another
Yes,
motion?
no, yeah, you can do that because it's just an adjournment motion.
Okay, previous roll call. All in favor signify by saying aye.
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 Opposed? Motion carries. We are adjourned. I'll see all of you, or some of you, at the committee meeting next Wednesday.
Next Wednesday.
Thank you all
Thank
for
you.
attending.
Thank you very
Bye.
much.
Thank you.
Bye.
Thanks, Mike, for attending, and thanks for your input. Gone. Okay, we're done.
Bye.